Seniors, what happens when you restore your vitamin D levels over 30 days? The changes can feel noticeable enough that, by the end of just 1 month, you may look back and hardly recognize how you used to feel. Vitamin D is essential for over 2,000 processes in the body, and as we age, it becomes even more important. When your levels are low, your energy can drop, your bones may ache, your mood can suffer, and your immune system may weaken. It's not just aging, it may also be deficiency. In this video, we'll uncover 5 powerful transformations that many people experience when they commit to taking vitamin D consistently for about 30 days. Stay tuned for change number 1. It may just be the most surprising benefit of all. But before we dive in, how old are you and where are you watching from? Drop a comment below. Let's make this a conversation, not just a lecture. Quick disclaimer. This video is for educational purposes only and is not a substitute for medical advice. Now let's get started. Change number 5. Your immune system quietly wakes back up. One of the very first changes people notice when they start taking vitamin D consistently isn't dramatic, but it's incredibly powerful. Many people report getting sick less often. Vitamin D plays a central role in immune function. It helps support immune cells, the body's natural defenders that patrol your system, searching for viruses, bacteria, and other harmful invaders. When vitamin D levels are low, these immune cells can become slower and less responsive. In short, your body's defenses may be weakened. Research has consistently shown that vitamin D deficiency is linked to more frequent colds, longer recovery times, and higher levels of inflammation. This is especially concerning for seniors because the immune system naturally becomes less efficient with age, and low vitamin D may contribute to that decline. Without enough vitamin D, the body can struggle to respond quickly and effectively to infections. The good news is that when you begin taking vitamin D consistently, these immune cells often begin to function more effectively. As vitamin D levels are restored, immune responses can become faster, more balanced, and more efficient. Over the following weeks, many people notice that minor symptoms, like a scratchy throat or runny nose, are less likely to escalate into a more serious illness. Recovery may feel quicker, and low-grade inflammation can begin to settle. In fact, a large 2017 review analyzed data from over 11,000 participants across 25 high-quality clinical trials. The researchers found that regular vitamin D supplementation, especially daily or weekly dosing, was associated with a reduced risk of acute respiratory infections. While the overall benefit was modest, the effect was much stronger in people who were deficient to begin with, lowering their risk by roughly 40% in that group. This finding is particularly relevant for older adults who are more likely to be deficient and more vulnerable to infections. Over the course of your first 30 days of supplementation, your immune system may begin to regain better coordination. It can become less reactive to harmless triggers and more efficient at responding to real threats. This balance, strong defense without excessive inflammation, is critical for healthy aging. To support these immune benefits, consistency matters most. A daily dose of 1,000 to 2,000 international units taken with a meal that contains healthy fats may help improve absorption and support steady immune function. Vitamin D needs vary by individual, so it's best to consult a healthcare professional before starting supplementation. And this immune support is just the beginning of what vitamin D can do for your body. Change number 4. Your muscles regain strength, balance, and control. If you've noticed weakness in your legs, difficulty standing up, trouble with balance, or a growing fear of falling, vitamin D plays a much bigger role than most people realize. Vitamin D doesn't just support your bones, it also affects your muscles. In particular, it helps maintain the function of fast-twitch muscle fibers, which are responsible for balance, posture, and quick corrective movements that help prevent stumbles. When vitamin D levels are low, these muscle fibers can weaken, reaction times may slow, and the risk of imbalance can increase. With consistent vitamin D supplementation, many people begin to notice changes within a few weeks. Muscle strength can improve, and communication between the brain and muscles becomes more efficient. In simple terms, your muscles respond faster and with better control, leading to improved balance, stability, and confidence in movement. A systematic review and meta-analysis published in the Journal of the American Geriatric Society which focused on seniors, found that regular vitamin D supplementation is associated with modest improvements in muscle strength and balance, key factors for stability and reducing the risk of falls. These benefits are most noticeable in those who were low in vitamin D at the start. Vitamin D also helps muscles use calcium effectively, which is essential for proper contraction and relaxation. Without enough vitamin D, muscles may tire more quickly, making everyday activities feel harder than they should. Over time, many people notice that daily movements become easier. Standing up from a chair, climbing stairs, or walking longer distances without that familiar heavy legs feeling. Gradually, strength returns, movement feels steadier, and confidence improves. For best results, take vitamin D with food and combine it with gentle physical activity, such as walking, to further support muscle function and help reinforce these gains. And the changes don't stop there. You might notice something shifting in ways you never expected. But before we continue, if you've been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Change number 3, your blood pressure and circulation. Begin to stabilize. Vitamin D does more than support bones and immunity. It also plays an important role in your cardiovascular system. One of the ways it helps is by supporting the renin-angiotensin system, which regulates blood pressure and fluid balance throughout the body. When vitamin D levels are low, this system can become overactive, causing blood vessels to constrict and blood pressure to rise. Observational data from the 3rd National Health and Nutrition Examination Survey show that adults in the United States population with higher vitamin D levels experience smaller age-related increases in systolic blood pressure. Effects are often modest and occur over longer periods, particularly in those with deficiency or existing hypertension, based on subgroup analyses. This suggests that maintaining adequate vitamin D may help support more stable blood pressure as people age, a benefit especially important for seniors whose cardiovascular system can become more vulnerable over time. With consistent vitamin D support, blood vessels may gradually relax, circulation can improve, and the heart doesn't have to work as hard to move blood through the body. Many people notice simple but meaningful changes: warmer hands and feet, improved endurance during walks, and less shortness of breath with mild exertion. Vitamin D may also help reduce inflammation in blood vessel walls, supporting long-term cardiovascular health and ensuring smoother blood flow throughout the body. To maximize these benefits, consistency matters. Daily vitamin D intake tends to produce better results than sporadic dosing. Pairing it with magnesium and potassium-rich foods, like leafy greens and bananas, can further support healthy circulation. And as your body adjusts, the next change starts working quietly behind the scenes, without you even realizing it at first. Change number 2, your sleep quality improves from the inside out. Vitamin D plays an important role in regulating melatonin, the hormone responsible for the timing and depth of your sleep. When vitamin D levels are low, sleep disturbances, such as insomnia, fragmented sleep, and early morning awakenings, can become more common. Researchers have found that vitamin D receptors are located in areas of the brain that influence sleep cycles. Analyses of data from the United States National Health and Nutrition Examination Survey found that low vitamin D levels are associated with poorer sleep quality, more disturbances, and reduced sleep duration. This suggests that supplementation to restore levels may improve sleep architecture, reduce awakenings, and boost daytime alertness, particularly in older adults with deficiency. Vitamin D also may help reduce nighttime inflammation and muscle discomfort, which can disrupt sleep in seniors. This soothing effect can allow for deeper, more consistent rest. For the best sleep benefits, vitamin D should be taken earlier in the day. Taking it late at night may interfere with melatonin production in some people, which could lead to sleep difficulties. And while your nights get better, change number 1 affects every part of your life, mentally, emotionally, and physically. Change number 1, your mood, cognition, and mental resilience improve. Vitamin D plays a vital role in brain health. It helps support important neurotransmitters like serotonin and dopamine, protects neurons from inflammation, and contributes to overall cognitive function. When vitamin D levels are low, the effects can be wide-ranging. Deficiency has been linked to depression, anxiety, brain fog, and a higher risk of cognitive decline, which is especially concerning for seniors. Analysis of data from the National Health and Nutrition Examination Survey in the United States shows that higher vitamin D levels are associated with fewer depressive symptoms and better cognitive performance, particularly in adults with deficiency. This suggests that maintaining adequate vitamin D may help support mood, emotional well-being, and mental sharpness. Over the course of 30 days, many people notice improvements in emotional stability, clearer thinking, better memory recall, and reduced mental fatigue. That constant feeling of mental heaviness may lift, replaced by a brighter, clearer mind. Vitamin D works by reducing neuroinflammation and supporting better blood flow to the brain, allowing neurons to communicate more efficiently. This isn't about temporary stimulation or quick fixes. It's about restoring balance in your brain's function. When your brain has the raw materials it needs, it can start performing closer to the way it was designed to, helping you feel more alert, focused, and emotionally resilient. Before making any changes to your supplement routine, please consult your healthcare provider. To keep improving your health and getting the most from your supplements, watch the next video. Every tip can make a real difference. And make sure to subscribe to get more tips to keep your health on track every day.